As the US climbs to over 26,000 deaths from COVID-19, health officials are scrambling to address the disproportionate impact on Black Americans. Amongst the many discussions taking place, the question of why African Americans are disproportionately affected is being considered. Let's take Chicago, for example. The data released so far shows that 68% of the coronavirus deaths in the city have been of African Americans, despite the fact that they make up only 30% of the population. Whilst debate rages on as to the complex reasons behind the figures, I'd like to offer these two simple underlying factors: social inequality and structural racism. According to census data, Black residents in some of the African American neighborhoods in Chicago have a life expectancy that is a full 16 years lower than those living in predominantly white neighborhoods. These neighborhoods are often separated by only a few miles. Looking at the bigger picture, more than 20% of Black Americans live in poverty. That's twice the rate of white Americans. With poverty, of course, comes all of the underlying health conditions that make COVID-19 potentially that much more dangerous. For example, African Americans are 50% more likely to have heart disease than white Americans, and 40% more likely to die at an early age from any cause. 19% of African Americans also can't afford simply to visit a doctor. The reasons why African Americans are more likely to be living in poverty or low socioeconomic neighborhoods is complex, but we have to remember that race and racial hierarchies in and of themselves are social constructs designed to and employed in justifying historical European colonialism and the atrocities of slavery. It is and always has been about claims to power. The data coming out of America quite clearly shows that this is still the case. Share the story.